The Navy SEAL was dying on the table. 3 bullets, one lodged near his spine. The surgical team had been working for 40 minutes and nothing was working. He was slipping away. Then the rookie nurse, the one they'd been hazing for 2 weeks, stepped forward without hesitation. Her hands moved differently, faster, cleaner, precise, and in 12 minutes she extracted all 3 rounds. The SEAL stabilized, the room went silent, and 2 hours later the FBI arrived. They didn't come to thank her. They came to ask one question: where did you learn to do that? Jordan Hayes clocked in at 18:47 hours, 13 minutes early like always. She swiped her badge at the staff entrance of Mercy Point Trauma Center and walked into the organized chaos of shift change. Day shift nurses handing off charts, complaining about patients, venting about residents. Jordan walked past without a word. No one looked up. She went to her locker, pulled out her stethoscope, pen light, trauma shears, clipped everything to her scrubs, checked her pockets. Gloves, alcohol wipes, tape, notepad, everything in the same order. The same place, the same routine. Then she closed the locker and stepped onto the floor. Mercy Point was a level 1 trauma center, the place where the worst nights ended up. Gunshots, stabbings, wrecks, overdoses. Jordan had been there 3 weeks, and for 3 weeks she'd been rookie. Senior nurses treated her like she was incompetent, residents ignored her assessments, attendings dismissed her questions. She never corrected them, never defended herself, she just did the work. That night they gave her Bay 4, post-op monitoring for a 53-year-old male, 2 days out from an emergency splenectomy after a motorcycle accident. Stable, boring. Exactly the kind of assignment they gave the rookie, and Jordan didn't mind. She checked him the way she checked everything, monitor first. Heart rate 78, blood pressure 118/74, oxygen 96, normal. Chart next, pain meds, antibiotics, anticoagulants, all correct. IV site clean, lungs clear, abdomen soft, dressing dry. Everything said fine, but something didn't feel fine. His skin looked slightly pale, his breathing was a touch too shallow, and when she checked his urine output, 180 milliliters over 8 hours, it was low. Then she pulled his labs, hemoglobin 9.2 down from 10.1 that morning. Dropping. No bleeding on the dressing, no obvious source, which meant the bleed was inside, slow and subtle. She flagged it, increased fluids, and ordered a recheck in 2 hours, then moved on like nothing was wrong. At 20:30, Diana, the senior nurse, mid-40s, 15 years in trauma, called her over and didn't bother hiding the tone. She told Jordan to restock every crash cart, check med room inventory because they were low on propofol, and then clean the break room because someone left a mess. Jordan nodded and said, "Yes, ma'am." She restocked the carts with the same quiet precision she did everything. Expiration dates checked, defib pads replaced, meds organized in sequence, then went to the med room and counted propofol. 12 vials, minimum stock was 10. They weren't low. Diana had sent her on a pointless errand just to remind her she was still the rookie. Jordan documented the count anyway and kept moving. At 2200, she was charting near Bay 6 while Dr. Patel, a second-year resident with confidence bordering on arrogance, wrote orders for a post-op gunshot patient who was supposedly stable. Jordan glanced at the monitor and saw the heart rate, 110. Not a code, not a crash, but wrong for stable and sedated. She scanned the orders, morphine for pain, standard dose, then noticed the patient was on metoprolol. That combination could push him into respiratory depression. She walked over and said his name. Patel didn't even look up, just snapped, "What?" And when she pointed out the interaction, he finally looked at her like she was an interruption. He asked who she was, called her the rookie, and told her he didn't ask for suggestions. Jordan didn't argue. She walked away, documented the concern, flagged the interaction, and set a reminder to check the patient's respiratory rate every 30 minutes. If he declined, she'd intervene, whether Patel liked it or not. At 23:40, the alarm went off in Bay 6. Jordan ran in and found the patient gasping, respiratory rate 8, oxygen saturation 84. Patel was at the bedside, panicking, saying he'd been fine 10 minutes ago. Jordan pushed past him, checked the IV, saw the morphine, and said it out loud. Respiratory depression from the interaction. Patel started to protest, but Jordan was already moving. She grabbed naloxone, drew the dose, pushed it. Within seconds, the patient's breathing came back. 12, 16, oxygen climbing, 88, 92. Jordan stepped back like it was routine and told Patel she'd flagged it 2 hours ago. It was in the chart. Then she walked out before he could find the right words. At 100, the trauma bay finally went quiet. Jordan sat alone at the nurses' station finishing charting while everyone else was on break or asleep in the call room. She reviewed every patient, every medication, every trend until it all lined up the way it should. Then she closed the tablet, got a black coffee, stood by the window and looked out at the dark city. The disrespect, the condescension, the way they treated her like she was invisible, she didn't care. Invisible was safe, underestimated was useful, forgotten was exactly how she wanted it. At 3:20, the doors exploded open and the comm shattered. Paramedics burst in with a gurney moving at a dead run, bagging a patient while the lead medic yelled it out. GSW ×3, male early 30s, unresponsive, blood pressure 70/40. 2 liters in and still crashing. Castellano, the night attending, appeared. Residents scrambled, nurses moved into position, and Jordan set down her coffee and followed the gurney into the bay. The patient was young, fit, military haircut, tattoos, dog tags, and 3 entry wounds with no exits: shoulder, abdomen, lower back. The bullets were still inside. Jordan watched the vitals spiral. Heart rate 138, pressure 65/35, oxygen 81, dying fast. Ultrasound showed free fluid, a lot of it hemorrhaging. They rushed for lines, blood, surgery, but the angles of the wounds bothered Jordan. The shoulder shot was angled downward like it was meant to disable. The abdominal shot tracked in a way that avoided major organs. The lower back shot was precise. Close to the spine, but not through it. This wasn't random. It was calculated, shot to incapacitate, not kill. Then Jordan saw the dog tags clearly and her breath stopped. Not a name, a call sign, Condor. Castellano worked fast. Chest tube, incision, suction. But the pressure kept dropping and he couldn't get the angle on the abdominal track. The monitor screamed, the patient spasmed, and a resident said he was seizing. Jordan spoke from the edge of the room, calm and quiet, and corrected him. It wasn't a seizure, it was a reflex response. The bullet near the spine was compressing a nerve root, triggering myoclonic jerks whenever they manipulated tissue. Castellano stared at her like she'd crossed a line, but she didn't stop. She told him the abdominal bleed wasn't the primary source, too slow, too venous. The real volume loss was from the shoulder wound, a nick to the subclavian artery. He demanded to know who she was. She said only night shift nurse. The monitor kept screaming. Diana said they were losing him. Castellano looked from the patient to Jordan and made a decision. Fine, show me. Jordan stepped in without hesitation, gloved up, palpated the shoulder entry, traced the trajectory with her fingers, and explained the bullet's position, just posterior to the subclavian artery, how it shifted and reopened the bleed. She took forceps, approached from below the artery, not above, and extracted the first bullet cleanly. She dropped it into the tray and told Castellano to clamp the vessel. He did, sutured the tear, and the bleeding slowed, then stopped. The pressure stabilized and started to climb. The room stared at her as if the air had changed. Jordan stripped her gloves, stepped back, and said 2 more to go. She moved to the abdominal wound, identified the bullet's position in the retroperitoneal space embedded in the psoas, and corrected their approach. Come in laterally. Go with the grain of the muscle fibers, don't cut across. Castellano followed her direction, found it, extracted it. 4 minutes. The second round hit the tray and nobody spoke. Then Jordan moved to the lower back wound, the one near the spine, the one that could paralyze him if they were wrong. Castellano wanted imaging. Jordan said there wasn't time. She studied the displacement, the angle, the anatomy, and in the same calm voice said she could do it. Castellano reminded her she was a nurse. Jordan repeated, I can do it. Then Castellano stepped back. Jordan palpated, found that the bullet was lodged in the transverse process, lateral to the spinal cord, close but not pressing, meaning it could come out if she didn't shift it medially. She inserted the forceps slowly, metal against bone, adjusted the angle millimeter by millimeter, and after 5 minutes she lifted the third bullet free. The spasms stopped, the body relaxed, the vitals stabilized. Heart rate 98, pressure 88/52, oxygen 94. Jordan pulled off her gloves, dropped them, and walked out while the room stayed frozen behind her. She locked herself in the staff bathroom and washed her hands under cold water, slow and methodical, staring at her reflection like she was making sure she was still here. Her face stayed calm, neutral, but her hands shook when nobody could see. She hadn't moved like that in 2 years, not since the tent, the sand, the blood, the gunfire, the weight of lives in her hands. She breathed until the room stopped spinning, dried her hands, unlocked the door, and went back to the nurses, stationed like it was just another shift. At 5:20, two men in dark suits walked into the break room, federal, not hospital, and one of them spoke her name. He showed an FBI badge and told her they needed to ask about what she did in the trauma bay. Jordan closed her laptop and asked what about it. The agent said she extracted 3 bullets from a Navy SEAL in 12 minutes with precision most trauma surgeons couldn't match. And then he asked the one question that mattered. Where did you learn to do that? Jordan said she was a nurse and she assisted the attending physician. That was her job. The agent smiled without warmth and said that wasn't what Castellano told them. His partner added the patient's identity. Lieutenant Commander Jason Marks, call sign Condor, SEAL Team 6, shot in what looked like an attempted extraction. Someone wanted him alive. Someone else wanted him dead before he could talk. Jordan asked if she was under arrest, if she was being detained. Both answers were no. She said then she was going back to work, but the second agent didn't move from the door. The first agent opened a folder and slid it across the table and said, "We know who you are." The document inside carried a different name and a different life. Captain Maya Reyes, U.S. Army Ranger Regiment, attached to a Tier 1 unit as a Special Operations Combat Medic. Multiple deployments, medals, records, then a disappearance 2 years ago. A resignation, a new name. A civilian job in a hospital that didn't know what she was capable of. He asked why. Jordan didn't answer. He said Condor was awake and asking for her. Jordan said he didn't know her. The agent said he insists he does. In the ICU, in a dim room filled with monitors, Condor opened his eyes and recognized her immediately. He called her Maya. He remembered Syria, 2019. An IED hit, shrapnel to chest and leg, how she pulled him out and kept him breathing until the bird arrived, how she told him to look at her and stay focused on her voice. How she promised him he wasn't dying that day. Jordan tried to keep it clinical, but memory cracked through anyway. Condor asked why she left, and she shut it down. She didn't owe him her story. He told her someone ambushed him outside his apartment, professional shooters, not trying to kill him outright, trying to take him because he knew something that scared powerful people. He said they would come again. Jordan said the FBI would handle it. Condor said the FBI couldn't protect him from this. He said, but you can. Jordan told him she wasn't that person anymore. Condor said, yes, you are, you just proved it. Back on the floor, Diana confronted her, said what she did wasn't normal, that no nurse moved like that, not even the surgeons, and demanded the truth. Jordan asked what she wanted her to say. Diana asked, who are you? Jordan said she was the night shift nurse, and that was all Diana needed to know. She clocked out at 700 but didn't go home to sleep. She sat in her car staring at the hospital, at the ICU windows, thinking about how exposed Condor was. Then she opened a secure app she hadn't touched in 2 years and sent one message asking for eyes on the ICU, room 8, possible threat. The reply came back almost instantly, copy on it, stay safe, Maya. Jordan deleted the conversation and drove home. In her apartment, small, clean, anonymous, she opened a locked drawer and stared at a metal case holding her old ID, medals, discharge papers, and a photo from the desert. 12 people, Delta. 2018, names she remembered, voices she still heard, 3 of them dead. She locked it away, but she couldn't lock away the truth. Condor was right. She could change her name, her job, her city, but she couldn't change who she was. And whether she wanted it or not, the war had found her again. The next day, Diana told her she was assigned to ICU, not trauma, room 8, specifically requested. Jordan didn't want special assignments, but it was already done. In the ICU, another nurse briefed her. Condor stable, awake, watching the door, asking for her, then told her the FBI was waiting to talk first. Carter and Russo confronted Jordan about the secure message she sent, warned her it was illegal, said the NSA flagged it and routed it to them, and told her if she did it again, they'd detain her. Jordan didn't apologize. She told them she did it because they couldn't protect him. Carter admitted Condor was a witness to something that could bring down powerful people, people with resources, people who didn't leave loose ends. He showed her surveillance photos, contractors, mercenaries, and a name behind them. Natasha Kovic, CEO of a private military contractor with money, contracts, and motive. They couldn't move Condor yet, too unstable, maybe 48 hours. Jordan asked what they needed. Carter said keep him alive, tell us if anyone tries to get close. Jordan agreed, but inside she knew 2 days was a lifetime. That night, Jordan sat beside Condor as his nurse while he tried to rest and failed. He warned her Kovic's people would come. Jordan told him to heal, to sleep, and when he asked what she'd do after this was over, she said the same thing as before: work, stay quiet, stay invisible. He called it not a life. She called it a choice. When he asked why she walked away, her voice went quiet, and she admitted she lost someone she couldn't save, and realized that no matter how good she couldn't save everyone. So she stopped trying. Condor didn't force details. He just said he was glad it was her, and Jordan told him again to sleep. At 2:30, her phone buzzed, unknown number. Warning: 2 black SUVs entered the parking lot, no plates, 4 occupants armed, moving toward ICU access. Jordan's heart spiked. The FBI agents outside the room were gone. She called Carter. No answer. Called Russo. No answer. She locked the door, killed the lights, and told Condor they were here. He tried to move, and she stopped him. He'd tear sutures. He asked the plan. Jordan told him the plan was he stays in bed and she handles it. Then she listened as footsteps approached. Voices in the hall confirmed room 8 talked suppressed weapons, clean extraction. The lock picked fast. The door opened slowly. The first hostile entered and didn't see Jordan behind the door. She swung an IV pole into his head, dropped him, caught his pistol, checked the mag, and moved to the doorway. 2 more came down the hall. She fired twice, sent her mass, and both went down. The 4th returned fire from the end of the corridor, and Jordan dove back into the room as rounds punched through the frame. She used the bed as cover, checked her ammo, realized there were no exits, 3rd floor, no fire escape, so she made a new option. She rolled an oxygen tank to the door, opened the valve, and shot it. The explosion ripped the door off the hinges, filled the hall with smoke, triggered alarms and sprinklers, and Jordan moved low through the chaos. The 4th hostile was down, unconscious. She kicked his weapon away and restrained him with an IV line. Then more footsteps, running from the stairwell, and Jordan raised the pistol until Carter and Russo emerged through the smoke. They froze when they saw her, the bodies, the destruction. Jordan cleared the weapon and put it down. Carter asked what happened. Jordan said 4 hostiles attempted extraction and she stopped them. Carter realized the fire alarm on the 2nd floor had been a diversion, planned to isolate the target, and admitted the location was compromised. They moved Condor immediately, tactical transport, armored vehicle, federal agents, and Carter demanded a statement. Jordan told him she had other patients who needed care and the statement could wait. Carter ordered her to report next day, Federal Plaza, 900. Jordan said she'd be there. By morning, the ICU was quiet again, smoke cleared, bodies removed, damage assessed, and the older nurse asked Jordan if she was okay. Jordan said she was fine. The nurse said she'd never seen anyone move like that and asked if Jordan was coming back. Jordan didn't answer. She removed her badge, set it down, told her to take care of the patients, and walked out. Jordan went home, packed a single bag, clothes, cash, fake ID, and vanished before anyone could stop her. She texted Carter once. She wouldn't be at Federal Plaza, she was done, Condor was safe, don't look for her. Then she snapped the SIM, dumped the phone, and disappeared. 3 weeks later in Billings, Montana, a woman with short brown hair and calm eyes walked into a small rural hospital and applied for a night shift ICU position. Her paperwork was clean. Her references verified. Her name was Sarah Cross. She said she was an Army medic, stateside only, nothing exciting. The manager hired her and asked when she could start. She said tonight. That evening, Sarah Cross clocked in at 1900 hours and moved through the ICU the way Jordan Hayes always had. Quiet, efficient, invisible. She checked her first patient more carefully than paper could ever show. noticed the subtle pause in breathing, adjusted care before anyone else would have caught it, and continued down the line as the unit slept. At 200, she sat alone at the nurse's station and looked at one saved phode. Delta, 2018, faces, names, the dead among them, and one man she'd loved. Captain Elias Chen, her partner. Killed in Syria 2020, dying in her arms after 18 minutes of everything she had. She deleted the photo because she didn't need reminders. She already carried it. 2,000 miles away, in a secure federal facility, Condor agreed to testify to bring Kovik's network down, all of it. The prosecutor asked about the nurse. Carter asked if they should find her. Condor said no. He said she'd saved his life and asked for nothing. That's not someone you charge, that's someone you leave alone. And somewhere in Montana, Sarah Cross stood at an ICU window looking into the dark, feeling the weight of the past, the weight of training, the weight of loss, and the quiet peace of doing what she was meant to do. Keeping people alive, one shift at a time, one patient at a time, and when the next crisis came, when someone needed her, she'd be ready, because medics didn't quit, they just found new battles. Quietly, invisibly, until the call came again.